Hi, my name is Aubrey Meinritzma, and today I'm going to show you how to immediately assess a wound that your horse might have. So this is my horse Allie, and she has had a lot of injuries in the past, so I've kind of had to learn how to assess immediate injuries because she's beat herself up a lot. So the first thing you want to do is kind of assess the wound. So here's my wound. It's just ketchup, but yeah, I decided to kind of get the right look. So the first thing you want to look at is how bad is your wound. If you come up upon a huge gaping wound, then the first thing you need to do is call your vet and get them over here right away because that'll probably need stitches. But some injuries don't need stitches. They're just pretty bad cuts that you want to be able to take care of. So I'm looking at this cut and I'm going to say, I don't think I need to call my vet right now. It's not a huge gaping wound that needs stitches immediately. But first thing I'm going to do is rinse it out with some cold water. I got my hose here and it's just have a gentle pressure of water. And I'm just going to run it down her leg and kind of clean out that wound. And I'm using nice cold water to help stop the flow of blood too, because yeah, cold water can stop that blood flow. But I'm just rinsing off the blood and some of those particles that could have gotten into the wound. And I'm rinsing in a downward motion so they can all flow down off of her leg. So once I've done that, I think, depending on what it looks like, it might be a good idea to kind of use some gauze to clean out the wound. So I'm just using a gauze pad. You can also use like a cloth. I wouldn't recommend using like a cotton ball or anything because those can get cotton into the wound, which is not good. So you can just kind of gently wipe at the wound. No hard pressure, that's going to hurt her, but just gentle pressure to wipe off some of the extra stuff that might kind of be stuck in there. And then next, so here I have some triple antibiotic ointment, which really there's a lot of different options for antibiotic ointment you can use here. This is just probably from the dollar store. It's just triple antibiotic ointment, and this is a good idea just to help prevent infection, and because yeah, leg wounds can easily get really infected. So what I would recommend doing is grabbing some of that gauze again and just spreading this on your gauze and then kind of pressing it onto your wound, just like that. And then the next thing I would recommend doing is wrapping her leg with the gauze and the antibiotic ointment in there. So for this, I have vet wrap, which is a pretty common thing that we have around here. We have a lot of vet wrap. So this would be a good thing to wrap with, or you can use like a polo wrap. Whatever you got really works. But I have some vet wrap, so that's what I'm going to use. So I just place this on the wound and then kind of use my vet wrap to kind of wrap her leg. I'm not going to do her whole leg, but you kind of get the picture. Just wrap it over the wound so nothing else can get into the wound, and so you kind of just have some pressure on it to stop that bleeding a little more. And then, yeah, I would recommend probably putting your horse in a stall if you have one. I don't know if I would put them directly back out in the pasture because they can easily get their leg maybe caught on different things, and they can do a little too much like strenuous stuff to kind of hurt their leg a little more. And then just keep an eye on it, watch for swelling. To check swelling, you can run your hand kind of down their leg and feel if it's swollen, feel if it's hot. If those might be signs of infection. If it's getting really swollen, feels really warm. So over the next couple hours for sure, just keep an eye on it. If it gets worse, I would definitely call your vet. But the main thing you want to keep an eye on is preventing infection, because yeah, an infected leg can be pretty bad. So thank you for watching. I hope you learned a little bit about kind of immediate care for cuts in this video, and yeah, thank you for watching.